Well, sports, it's something we do to pass time, to enjoy ourselves, and even to lose weight, among other things. Today, we're taking a look at how one former Texas college athlete is using sports to help lead her toward a better quality of life.
I think I was 8 years old when I started playing basketball, trying to go between the legs, behind the back.
This isn't a story about basketball.
I was just some little girl from Bryan, coming to Texas college playing basketball.
At least, not on the surface.
I've been around basketball my whole life.
But you wouldn't know it based on how it started.
I used to step on the court, and anything that was going on in my life, it disappeared.
And neither did Alexandria Sims. For her, this sport
Basketball was my biggest outlet.
isn't just a game.
They used to hate guarding me on the court. They'd be like, oh, here comes Sims.
This is a story about how this sport helped her express pain she internalized for far too long.
Basketball was just like, I'm gonna make it out of my situations that I'm in because of basketball.
While also learning about self-care and her own mental health.
I dealt with self-mutilation. I dealt with suicidal thoughts.
It's a story about a young woman showing her strength on the court as one of the many faces who struggle with a form of mental illness. You see, Sims lost her father at a young age, and it still affects her today.
I went through middle school and high school kind of lost, and I was down, and I was angry because I just couldn't figure out, why.
Grieving her loss has been a challenge that she recognized and knew to take action. At 13 years old, for the first time, she had her first session with a therapist.
Her name was Dr. Rocky. I loved her. She was one of my favorites.
Another first.
That's when I kind of just let everything out.
Her dad's death was only the beginning.
Even before my father's death, I was dealing with bullying, low self-esteem.
Let me ask you this. Have you ever contemplated not being here?
Yeah. It used to get bad for me.
The key to this story, and perhaps the most important part, she sought help. Take a look at these numbers. According to the Health and Human Services Office of Minority Health, African Americans are 20% more likely to experience serious mental health problems than the general population, many never seeking help. From a lack of information to misunderstandings, even faith, spirituality, and community playing a major role. Only about a quarter of African Americans seek mental health care assistance compared to 40% of whites. It's one of the reasons why at 21 years old, with her entire life ahead of her, Alexandria decided to take a stand.
What's your message now?
The big thing I like to say is heal the mind.
And a shot to show others it's okay to seek help.
There's gonna be times where you feel like there's no escape from this, but me being on that dark side of a lonely world, it's possible.
All right, with me now, Dr. Ushimbra Buford. I got that right, didn't I? All right, a psychiatrist practicing at UT Health East Texas. Thank you so much for being here today.
My pleasure.
All right, you're very welcome. Now, before we dive into specifically African Americans and our access to mental health care, can you talk about just the importance of having good mental health?
Okay. Well, mental health for years has kind of been seen as separate from physical health, but quite honestly, they're so intertwined. We know that the mind can influence how the body. People who have experienced early life stress have a higher propensity for heart disease going forth. So good mental health can lead to great physical health for everyone. And I tend to think more of it as an architect than a firefighter when it comes to mental health. Instead of when there's fires and putting out problems, we like to help people build good houses for their mental well-being to stay within, if that makes sense at all.
That makes a lot of sense. So one stat I found says this: only about a quarter of African Americans seek mental health care. That's compared to 40% of whites. Why aren't we seeking help?
Well, I've been a psychiatrist now for about 14 years, and I see that every group does not seek health care the way they should. Health care and mental health specifically. 1 in 4 Americans can, through their lifetime, have the incidence of having a mental health disorder. out of that, only when we run the numbers, out of them, they may have one contact with a mental health professional in their life. So every opportunity is an opportunity to kind of bring people to understand the importance of it. For just speaking to the black community, you know, we've had years of not trusting hospitals and doctors, so that may, and also then just the stigma of having mental health problems is still very large in the black community.
So what do we need to do to try to fix this problem? What's your advice to folks out there?
Well, a lot of what I tell my residents, I'm actually a program director at UT.
Right.
I train the next generation of psychiatrists, and for them and also patients I see is that we have to stop being afraid of our weaknesses. Learn how to turn weaknesses into strengths. So when an individual has a problem, they need to seek help for anything. I always tell them it takes a strong person to say I need help.
Yes, it does. What advice, not advice, excuse me, how can folks reach out to you or reach out to UT Health East Texas if they indeed do want to seek some help?
Well, I mean, we can go to the website. You know, we now are UT East Texas. The entire network, our hospital is now a part of 10 with everyone. The telephone number to our outpatient clinic is 903-877-7000, and they can call there and request an appointment to get an evaluation.
Dr. Buford, I know we don't have even enough time to touch on all the topics that we need to get on, but thank you so much for being here. I'll probably pick your brain a little bit more during the commercial break. Brian, I'll go ahead and send it back to you.
All right.